Before performing any procedure involving IVs, it is important to perform hand hygiene and to put on gloves. It is also important to close the curtains around the patient's bed or close the door to give the patient privacy. Another important thing is to always inform the patient of the procedure and explain what is going on. And at the end of the procedure, it is important to document what you have done. The first step in initiating peripheral IV access is to determine the most desirable place and the most accessible vein. You'll want to use a venous site that is most likely to last the full length of the prescribed therapy, and the forearm is a really good place to access this area right here because it still allows for the patient to do some self-care, and it also helps prevent accidental removal and occlusions. For the most part, either arm can be used for IV therapy. It is a good idea to use the non-dominant arm because, again, the patient is more likely to use the dominant arm for self-care and other activities. And it's also important to be reminded of anything going on with either arm, such as any bruising or infection, anything that may contraindicate using that arm for IV access, lymph node removal, burns, things like that. You'll also want to start with a distal location first, because if one of these veins blows while trying to do IV access, you would have more options as you go proximal to the body, whereas if you started here, the same options are not available if you're going the other way. So I'm first going to start by going over how to initiate intravenous peripheral access. You should always note that when opening and handling IV equipment, it's important to use aseptic technique. It is also important to remember to label the tubing when you are initiating peripheral access or when you are changing the tubing. This way you can always know when the tubing needs to be changed next, and it's usually within 72 hours. The process starts by setting up the administration set. You will first clamp the tubing on the IV administration set to prevent air and fluid from entering the IV tubing. Next, you will invert the IV solution and take the cap off of the entry site, and make sure not to touch the entry site so that you don't contaminate the bag. You will then use a twisting and pushing motion to put the spike into the IV container. You want to make sure you don't touch the spike also. Then you will hang the IV container on the IV pole and squeeze the drip chamber to make sure that it's about halfway full. Then you will open the IV tubing clamp and allow the fluid to move through the tubing, and make sure that there are no air bubbles, there are no kinks, that sort of thing. So you'll make sure that the tubing is primed with the IV solution, and then you'll close the clamp again. At this point, if you're using an electronic device, you will follow the instructions for inserting the tubing into that particular device. So then, to initiate venous access on the patient, you will place the patient in low Fowler's position and place an absorbent pad underneath the patient's arm. Then you will open the short extension tubing and attach the needleless connector or end cap. You'll clean the connector with an alcohol swab and insert a syringe with normal saline into the end cap, and fill the extension tubing with normal saline so that you can prime that tubing as well. You'll then place that extension tubing back on the package within close reach so that you can use it later. Then you will select the right vein. You'll feel for the vein. If this side is dirty, you'll want to wash it with soap and water. If it's hairy, you'll want to clip it so that there's no hair that would be near the site. Then at this point, it's very important to perform hand hygiene and put on gloves. You will then place a tourniquet anywhere from 3 to 4 inches above the insertion site. so that you obstruct blood flow and distend the vein. At this point, it's really important to check for the radial pulse to make sure that the pulse is present and that the arterial supply is sufficient. You will also instruct the patient to keep his or her arm lower than heart level, and it's a good idea to have him or her pump their fist, because this also helps to distend the vein by making blood flow through it faster. If this isn't sufficient, if this doesn't work, you can also lightly stroke the vein upward, and if that doesn't work, you can also put a dry, warm compress on the vein for 10 to 15 minutes. Once that's complete, you will then clean the site with something like chlorhexidine or whatever your facility uses to clean the site. You will want to make sure that you press the applicator against the skin and go in a back and forth rubbing motion for about 60 seconds or so, and then allow it to dry. You will then place your non-dominant hand, which would be my left hand, about 2 to 3 inches below the IV entry site and pull the skin taut against the vein and avoid touching the prepared site. At that point, you will align the IV catheter on top of the vein and enter the skin gently while holding the catheter by the hub in the dominant hand with the bevel side up at a 10 to 15 degree angle. You will insert the catheter either directly above the vein or to the side. It depends on what works best for you. When inserting the catheter into the vein, a sensation of give can often be felt. At this point, you will observe for blood return into the flashback chamber of the catheter and advance the catheter a little more when this happens. You will then use the push-off tab to separate the catheter from the needle and then advance the catheter into the vein until the hub is at the venipuncture site. It's important to remember push, pop, pull when doing this procedure. Then you will release the tourniquet and activate the safety mechanism on the needle stylet and attach the extension tubing, and make sure that you're not letting go of the catheter while you're doing this until it is taped into place. You will aspirate and flush the catheter with saline while observing the site for any leaking or complications. The catheter should then be removed immediately if there are any complications, and that vein should not be used for IV therapy at that point. If all goes well with the procedure, you will use a skin protectant around the site where the dressing is going to be placed. You will then place a sterile, transparent dressing over the site, making sure to press down on the catheter area to prevent it from moving before you press down the rest of the area. You will then label the IV dressing with the date, time, and site, as well as the type and size of catheter that you have used. It is also important to loop the tubing near the area and secure it with tape as well, so that it's not moving around and potentially dislodging the catheter. You will then remove your gloves, perform hand hygiene, open the clamp on the administration set, turn on the infusion pump, set the rate, and start the infusion. And then before leaving the room, you will want to check the tubing and the IV site and make sure that the tubing, there are no air bubbles, no kinks or anything like that, and then apply antiseptic end caps to each access site. When changing an IV solution out for a new one, if you're using an electronic infusion device, you will first want to place that on hold to pause it. Then you will close the clamp on the administration site that is closest to the drip chamber. There are a couple of ways to change out an old IV container for a new one. I've actually done this at Bar-H, and I did it while holding both the old and the new in my hand at one point, and it seemed a little more difficult. You can also change it out by hanging the new bag on the IV pole, taking the cap off the end cap, making sure not to touch it, of course, and then removing the old bag from the IV pole, taking the spike out, making sure not to touch it as well, and then using a twisting and pushing motion, you can actually insert that into the new bag while it's still hanging on the pole. This sounds easier to me, although I've never actually tried it, so I'm not sure if it is actually easier. If you're using the electronic device, you will then open the side clamp next to the drip chamber, verify the flow rate that is programmed, and then turn on the device. When you're changing out the entire administration set, in addition to the IV solution, you'll want to make sure that the clamp is closed on both the administration set as well as on the short extension tubing that's connected to the IV catheter on the patient's arm. If you're using an electronic infusion device, you'll remove the current administration set from the device. You will first put on gloves and then remove the current tubing from the end cap on the short extension IV tubing, and then clean the connector with an antimicrobial wipe. Allow it to dry and then remove the cap from the new administration set and insert it into the end cap. You will then loop the administration set tubing near the entry site and anchor it with tape so that it doesn't move. Then you will open the clamp on the extension tubing and open the clamp on the administration set as well. Check the drip chamber, verify that the flow rate is correct, and turn on the device. Then you will apply the disinfectant caps to each access site on the administration set and check the tubing for any kinks or any air bubbles, as well as check the IV site for any infiltration or signs of something going wrong. When you're monitoring an IV that is being given with the use of an electronic fusion device, it's important to check the infusion rate and to note the position of the fluid in the IV container in relation to the time tape. It's also important to teach the patient about any features on the electronic device, such as any alarms or indicator lights, and to instruct them to call for assistance if they experience any pain or discomfort, if they notice that the bag is almost empty, or if any alarm is sounding. If an IV is being infused via gravity, it's important to check the drip chamber and to time the drops. It's also important to check the tubing for anything that might interfere with the flow, such as kinks or bubbles, and to make sure that the clamps are open in all positions. It's also important to observe the dressing for any leakage of IV solution, any bleeding, to inspect the IV site itself for any indication of infiltration, phlebitis, infection, bleeding, and to ask the patient if he or she is experiencing any discomfort or pain. If any symptoms of discomfort or pain are present, the IV should be removed and restarted somewhere else in the body. One complication that can occur is infiltration. This occurs when the catheter becomes dislodged from the vein and the IV solution is flowing into the subcutaneous tissue. Infiltration usually presents with pallor, coolness, and edema in the arm, as well as leakage around the site. Before changing the dressing on an IV, you will perform hand hygiene and put on gloves. You'll put a disposable pad underneath the arm with the IV access, and you will push pause on the pump if the solution is currently infusing. You will then hold the catheter with your non-dominant hand, and starting at the device hub, you will gently pull the dressing toward the insertion site and carefully remove the old dressing, making sure to not accidentally dislodge the catheter. You'll observe the site for any presence of phlebitis or infection or infiltration, and then if any are noted, you will relocate the IV. The next step is to cleanse the area where the new dressing is going to go. You're going to cleanse it with an antiseptic solution such as chlorhexidine in a back and forth motion for at least 30 seconds and allow it to dry. You will then apply a skin protectant to the same area and allow it to dry as well. Then you will place the new sterile dressing over the venipuncture site, being sure to fully cover the catheter before pressing around the rest of the site. Then you will label the dressing with the date and the time of the change and your initials, and then loop the catheter tubing and tape it into place near the entry site. You will then turn on the fluid infusion and check that the flow is right and the system is patent. And it's also important to apply an IV stabilization device if one is not already in place. When a continuous IV is no longer needed, the primary line can be capped and then converted into an intermittent infusion device. If using an electronic device to infuse, you will first stop the device and close the roller clamp on the administration set. You will put on gloves and then close the clamp on the short extension tubing that's connected to the catheter in the patient's arm. You will then remove the administration set tubing from the end cap and clean the end cap with an antimicrobial swab and allow it to dry. Next, you will insert a saline flush into the end cap and pull back to make sure that you aspirate the catheter first and check for positive blood return. If positive blood return is seen, you will then instill the solution for over 1 minute or per facility guidelines. Then you remove the syringe and reclamp the extension tubing. And if needed, you will loop the extension tubing and tape it into place near the entry site. After that, you will clean the end cap on the extension tubing with an antimicrobial swab and attach a passive disinfectant cap to the end cap. Before administering a blood transfusion, it is important to ask the patient about any previous blood transfusions that they may have experienced and any complications that may have occurred. The first step in administering a blood transfusion is to prime the blood administration set with normal saline. You will put on gloves and initiate peripheral venous access if it is not already in place. Connect the administration set to the venous access device through the extension tubing and infuse normal saline per the facility's policy. In the hospital setting, 2 registered nurses should compare and validate the following information while they are in the presence of the patient with medical record and the patient's ID band and label of the blood product. The things that need to be validated are the medical order for the blood transfusion, the informed consent from the patient's ID number, the patient's name, blood group and type, the expiration date, and the inspection of the blood product for any clots, gas bubbles, or clumping. The next step is to obtain a set of baseline vital signs before starting the transfusion. And if using an electronic infusion device, you would want to put the device on pause and close the clamp closest to the drip chamber on the saline side of the administration set. You will also close the roller clamp on the administration set below the infusion device. Next, you will close the roller clamp closest to the drip chamber on the blood product side of the administration set and remove the protective cap from the access port on the blood container. You will then remove the cap from the access spike on the administration set, and using a pushing and twisting motion, you will insert the spike into the access port on the blood container. You will want to make sure that you're not contaminating the spike or the access area whenever you're doing this. You will then hang the blood container on the IV pole and open the roller clamp on the blood side of the administration set and squeeze the drip chamber until the inline filter is saturated. You will then open the clamp on the administration set below the infusion device and set the flow rate to begin the administration. You'll start the administration slowly and make sure to stay with the patient for at least 5 to 15 minutes after the administration is started. You'll observe the patient for any adverse reactions such as itching, rash, flushing, or dyspnea. And then after 15 minutes, you want to reassess the vital signs and compare them to your baseline vital signs. After the initial observation, you will then increase the flow rate and calculate the rate to finish the infusion, and this should be no more than 4 hours. When the transfusion is finished, you will then close the clamp on the blood side of the administration set and then open the clamp on the normal saline side to allow the normal saline to be infused. You will then obtain the patient's vital signs and cap the access site, or you will resume the previous IV solution. Ongoing monitoring is very important throughout the duration of a blood transfusion so that any adverse reactions can be caught early. And if there are adverse reactions, the blood transfusion will obviously be stopped. The blood tubing should then be replaced with a new administration set that is primed with normal saline, and this should be infused at an open rate, which is usually about 40 milliliters per hour. It's also important to obtain vital signs and notify the provider as well as the blood bank of the problem that has occurred. When changing the dressing or flushing a central venous access site, you're going to want to make sure that the patient is in a comfortable position, allowing for easy access to the device. If a PICC line is inserted, you're going to want to make sure that the patient's arm is below heart level. First, you will apply a mask to yourself, and per facility policy, you're going to either apply a mask to the patient as well or have them turn their head away from the access site. You will then set up a sterile field on a bedside table within easy access. If an IV solution is running, you will stop the solution and slide the clamp on each of the lumen on the CVAD. Next, you will put on clean gloves and assess the insertion site through the old dressing and palpate the site, asking the patient if they experience any discomfort or pain. It's important to stabilize the catheter while you are removing the dressing to make sure that it does not get dislodged. And depending on the device, you may have to also remove the stabilization device and note any sutures or staples that are present. At this point, you will remove your gloves and perform hand hygiene and then put on sterile gloves. You will use a chlorhexidine swab to clean the area within 2 to 3 inches of the site and allow it to dry. Next, you will apply a skin protectant over the same area and apply a stabilization device if it's needed. Finally, you will apply the antimicrobial dressing and make sure that it is centered with the insertion site, and replace the end caps starting 1 lumen at a time and removing the end cap, cleaning the lumen, and applying a new cap to each one. If required, you may then need to flush the lumen of the CVAD with saline and heparin flushes. You'll work individually and clean each end cap on each lumen before doing so, before inserting the saline. You will also want to aspirate for positive blood return, and if positive blood return is seen, you will then insert the saline flush. You will then remove the saline syringe and insert the locking solution and instill that per facility policy, or over 1 minute. When that is finished, you will then remove that syringe and reclamp the lumen and remove your gloves. Finally, you will apply a passive disinfection cap to each of the end caps, making sure to clean the end first. The final step is to label the dressing with the date and time of change and your initials. And you will also want to make sure that the IV flow is accurate and that the system is patent. When accessing an implanted port, you're going to do the same thing that you did with the CVAD. You're going to make sure to put on a mask and either put on a mask for the patient or have him or her turn their head away. And then after putting on clean gloves, you're going to assess the location of the port and palpate the site to make sure that there is no pain and you don't see any redness. Then you perform hand hygiene and set up a sterile field with all of the supplies needed. You will then put on sterile gloves, connect the end cap of the extension tubing to the non-coring needle, Clean the end cap with an antimicrobial swab and attach a saline flush. You will flush with 10 milliliters of saline to prime the tubing. Then you will clamp the tubing, cleanse your site with chlorhexidine, and then using your non-dominant hand, you're going to hold the port stable underneath the skin and keep the skin taut against it. You will then visualize the center of the port. You'll pick up the non-coring needle and make sure to coil the tubing in your hand. Hold the needle at a 90-degree angle above the port, and you will then insert the needle at that 90-degree angle until the needle hits the back of the port. Then you will clean the end cap with an antimicrobial swab. When it's dry, you will insert the syringe of normal saline, open the clamp on the tubing, and flush with 3 to 5 milliliters of saline while observing for any leaking or infiltration. It should flush without resistance. It is important to note that if an antimicrobial locking solution was inserted when the port was last in use, this should first be withdrawn from the port and discarded prior to flushing. Whenever you are flushing, you're going to first pull back on the plunger to aspirate for blood return, and if positive, you then instill the solution for over 1 minute, or per facility guidelines. Then you remove the syringe and insert the locking solution syringe and instill the volume of the solution for over 1 minute. You will then remove that syringe and reclamp the lumen. If IV fluid infusion is to be initiated, you will not flush with heparin. You will apply skin protectant to the site and allow it to dry before applying the antimicrobial dressing to the site. Finally, you will apply a passive disinfection cap to the end cap on the extension tubing. When deaccessing an implanted port, you will first want to assess the site and note any redness or pain, discomfort, anything like that before starting the procedure. You will then clean the end cap with an antimicrobial swab and flush with saline after checking for blood return. Next, you will clean the end cap again with another antimicrobial swab and instill the locking solution. Next, you clamp the lumen and remove the syringe. You will then remove the dressing. You will then stabilize the port with your non-dominant hand, and using your other hand, you will remove the needle in a smooth motion at a 90-degree angle. Next, you apply gauze and apply a little bit of pressure, and then place a Band-Aid over top of the gauze. Before administering medications via intravenous bolus or push through an intravenous infusion, you're going to first want to assess the access site, noting any redness, inflammation, any signs of potential complication. You will then want to pause the pump if an infusion is currently being administered. Put on clean gloves and select the injection port on the administration set that is closest to the patient. You will close the clamp on the set above the injection port and remove the disinfection cap if there is one in place. If there isn't one in place, you'll want to clean the end cap before attaching the saline flush. You insert the saline flush into the end cap and aspirate the catheter for blood return. If blood return is present, then you will insert the solution over 1 minute or according to your facility's guidelines. You then remove the syringe, clean the cap again with another antimicrobial swab, and allow it to dry. You'll then insert the medication syringe into the end cap and inject the medication at the recommended rate while using a second hand on your watch to time the rate. While the medication is being administered, you want to observe the site and make sure there are no adverse reactions occurring. If an adverse reaction is to occur, you would immediately stop the infusion and contact the provider. After instilling the medication, you're going to use another swab to clean the end cap again and flush it with another saline flush. Then you will unclamp the administration set above the injection port, clean the end cap again, and attach a new passive disinfection cap, and then restart the infusion pump and check the IV fluid infusion rate. When administering medications via an intravenous bolus or push through a medication or drug infusion lock, you're going to do the same as you did before and check the site to make sure there's no redness, no inflammation, no infection, any sort of complication. Then you're going to put on clean gloves, remove the disinfectant cap if it is present. If not, you're going to clean the end cap with an antimicrobial swab. You will then stabilize the port with your non-dominant hand and insert the saline flush into the end cap. Release the clamp on the extension tubing of the medication lock and pull back on the syringe to aspirate for positive blood return. If it is positive, you then instill the solution over 1 minute or according to policy. You'll observe the insertion site while inserting the saline to make sure that everything is going well. There's no infiltration, no leaking, anything like that. After removing the syringe, you'll scrub the end cap with another antimicrobial swab and allow it to dry before inserting the medication syringe into the end cap. You then instill the medication at the recommended rate while using a second hand on your watch to time the infusion. While administering the medication, you're going to observe for any signs of complications such as infiltration or leaking. If any adverse reactions do occur, you will stop the infusion and notify the provider. After removing the medication syringe, you will then clean the end cap again with another antimicrobial swab and flush again with normal saline. If the medication lock is capped with a positive pressure device, you can just remove the syringe and clamp the extension tubing. If a positive pressure device is not present, you can gain positive pressure by first clamping the tubing while you're still inserting the saline and then removing the syringe. The final step in this process is to clean the end cap with another antimicrobial swab and apply a disinfectant cap to the end cap on the access port of the medication lock.